Caring for the Children of Abraham, Chapter 8. The operating room settled down after a couple of weeks to a more ordinary operating schedule with secondary war-related surgery, non-war elective surgery, and emergencies. There were many volunteers in the hospital. The regular hospital staff resumed their work and teaching programs were active again. Hadassah Hospital was very well endowed as a philanthropic project of the Jewish women's organization Hadassah. I was asked one day to see a young woman in status asthmaticus, persistent bronchial asthma. She had bronchitis, pneumonia, and very tight bronchial constriction. She was in severe respiratory failure. The pressure-regulated ventilator, breathing machine that is cycled when a set pressure is achieved, could not ventilate her. The highest pressure could not expand her lungs. Varying inspiratory and expiratory phases did not help. She needed a volume control ventilator, a breathing machine that is cycled after a certain volume is delivered. I looked around for another ventilator. In the corner of the room we were calling the ICU, there was a large rectangular form covered with a canvas drape. I pulled up the drape and could not believe what I saw. In the corner was a top-of-the-line, at the time very expensive, about the size of a hospital bed, European angstrom ventilator. The patient's nurse said, "Yes, but we do not know how to use it." I said, "I know a lot about ventilators. We can figure it out." I was not sure that I could. I cannot remember the inner workings of the machine now, but we got it going. We paralyzed the patient, connected her to the machine, and found that we could ventilate her. We gave her epinephrine, theophylline, antihistamine, cortisone, an antibiotic. Her bronchospasm was relieved after a few hours, and we were able to discharge her within a day or two. During those last 2 days of the war, when I first got to Israel, we had heard of an Israeli air assault on a U.S. Navy intelligence ship offshore in the Mediterranean. The rumors were that the ship was somehow compromising the Israeli military. I didn't know what the truth of this was, but I felt for my Navy brothers and their crippled ship. On an outing with some volunteers, we visited a kibbutz, one of the communal farms that Israelis were very proud of and people were curious to see. It was efficient, hard-working, and interrelated crops and labor. It seemed austere. One young American talked passionately about moving there with his wife and child about 18 months before. He had lost a leg in the war. I was called into the hospital to see an obese, bearded, elderly man. He had chronic lung disease, bronchitis, emphysema, a smoker. He was in respiratory failure and unable to clear secretions. The nurses asked if we could try to clear his secretions as we had for Ari. When I walked into the room, the man looked angrily at me. I asked that he be told in Arabic that we would try to help him breathe better. We tried to do postural drainage, percussion, artificial coughing, and secretion suction of secretions. He hollered at us in Arabic the whole time. I asked what he was saying and was told, "Doctor, you don't want to know." He did not want us to come back to try to help him. He died. I was in the recovery room when a post-op heart valve replacement patient arrested. She went into ventricular fibrillation. Her heart was not perfusing her tissues with blood. A surgical resident on the heart team and I began a gloriously successful resuscitation. We breathed for the patient with a breathing bag and pumped on the chest. We tried electrical conversion of the rhythm. We had given epinephrine and an ampule of bicarbonate. The fibrillation continued. The resident wondered out loud if he should cut the sternal sutures and reopen the chest. I noted the pupils were still small and reactive and said, "I think we have a good resuscitation with good perfusion. Her pupils are small. Let's give her ampule of bicarb, pump her chest a few more times, and try converting her again." We did. It worked. I was invited to the resident's family home. We parked our car and walked into the Orthodox quarter for a fine meal and chanting prayer. Tom Borman, the patient's heart surgeon, took me to Nazareth, a dry little Arab town then, where we saw patients in a small free clinic. Tom was, to me, an even-tempered nice guy. We stopped along the way to say hello to his friends back from the war. We turned left at Lake Tiberias, the Sea of Galilee, and climbed into the hills to Nazareth. Tom made me feel good about myself by letting me figure out a patient with an obvious case of coarctation of the aorta. You could diagnose from across the room on X-ray, notches under the ribs from the collateral circulation. The arteries under the ribs were enlarged to carry blood to the lower body around a narrowed segment of the aorta and caused a signature notch under the ribs. Tom might resect the narrowed segment of the aorta and put in a graft. Tom had observed that rheumatic mitral stenosis becomes a functional impairment at an earlier age in Israel than it does in the United States. To be continued.